across our state. A two-year budget bill is moving to the chamber floor. Senate Republicans advance the measure. Today, lawmakers discuss the first of two required floor votes. Now on your side's Dylan Huffman is digging deeper tonight. He joins us in the studio to break down those numbers. Dylan.
Yeah, Shayla, the Senate's budget plan involves about $24 billion over the next 2 years. Senators are still in session right now discussing the bill. In it are things like teacher pay, disaster funding, and rape kit testing. Taxes wouldn't go up in the Senate's budget, but the bill is likely to clash with Governor Cooper, who says Senate Republicans who wrote this bill have not done enough for teachers or for expanding Medicaid. Teachers would get a 3% raise as well as $300 a year for their school supplies. Most state employees would also get a raise as well. People who take jobs in prisons with the lowest number of employees, they would get bonuses. The budget also calls for clearing the backlog of untested rape kits that has support by both Democrats and Republicans. Senators want to see $1.1 billion set aside in the rainy day fund in case there's ever another disaster. Senator Jim Perry represents Lenoir and Wayne counties. He says it's hard to get a budget passed because of all of the back and forth.
It's kind of like my kids fighting over where we're going to eat. The only one happy is the one that suggested where we end up going.
As for Medicaid, this budget does not include expanding it, even though Governor Cooper says that is a central focus. His office is already pushing back on this proposed budget. And we know that cuts to Vidant Health are a big part of it as well. Not on your sides, Courtney Allen joins us now from the newsroom. She's been looking into this and how it could impact the hospital. Hey, Courtney.
Hi, Dylan. Yeah, the change would would halt preferential Medicaid treatment to Vidant as East Carolina University's teaching hospital, something that leadership at Vidant would impact negatively healthcare in the East.
The budget provision would end a favored status for Vidant Medical Center, cutting its Medicaid reimbursements by $35 million.
It will affect our ability to provide the compassionate, patient-centered care and community investment that this region both deserves and depends on.
Lawmakers for the cut say Vidant should not receive the benefit because it acted to keep the University of North Carolina Board of Governors out of hospital affairs. Vidant and Pitt County commissioners in April removed the UNC board from choosing 9 of the 20 hospital board members, something that Vidant CEO Dr. Michael Waldron justified in Wednesday's press conference.
The best governance structure is to have the board that knows the company the best determine who the new board members should be, instead of a group of people that sometimes have never even been to Eastern North Carolina, much less understand the issues that we face.
While the UNC board and ECU sued to try to block the change, Waldron says all parties agreed to a mediation process.
That's why we really, the other thing, don't understand these cuts, considering that these cuts were put in the Senate budget. But at the same time, our legal teams agreed to a process to resolve those issues.
Some believe that Vidant still deserves a Medicaid preference because it serves a disproportionate number of Medicaid patients in what Waldron calls one of the most difficult healthcare environments in the United States.
It will have a significant effect, and we will have to accommodate by adjusting the services that we provide and changing significantly what we do.
This $35 million cut would be in addition to the $38 million cut due to changes in the state health plan that is going into effect January 1st of 2020. These combined cuts, if the budget passes, will be more than $70 million, something the CEO of Vidant says will take up their entire bottom line. Now, there is much more to this story, so please visit our website at WNCT.com to get further details. Courtney Allen, 9 on your side.